So I'm Professor Alan Lopez and I'm the Director of the Bloomberg Data for Health initiative at the University of Melbourne, where I'm a Professor of Global Health. Well, without good quality mortality data, countries are planning in a vacuum. So it's really important, particularly for countries like Sri Lanka that are advanced in their epidemiological transition, to understand very clearly who's dying of what so these deaths can be prevented. The D4H initiative, Data for Health, was started in 2015 and it's funded primarily by the Bloomberg Philanthropies Mayor Michael Bloomberg, who believes very strongly in the use of information to guide policy, and he's done this in his financial work. Also a partner in this is the Australian government, and we're working in 20 countries worldwide, and we're trying primarily to fix the quality and utility of cause of death data systems for policy. Well, in Sri Lanka it's a little bit different because your vital registration system, which has been in operation for over 150 years, captures pretty much all the deaths. You're very good at registering the deaths. The problem in Sri Lanka, of course, is the quality of the cause of death diagnosis. It really matters to get the cause of death right because that's what health policy uses to plan health policies and practices. And so in Sri Lanka, what we're doing is two things primarily. One, focusing on the certification of causes of death in hospitals, teaching doctors how to correctly certify people who die in hospitals, and then for deaths outside of hospitals, dramatically improving the quality of the causes of death for those cases through a technique called verbal autopsy. So what we're doing is we're working with colleagues and experts in Sri Lanka to provide tools and guidelines and handbooks for improving death certification. Doctors are very busy, but they're also very smart, and they're able to understand principles very quickly if they're correctly trained. So we've worked with colleagues in Sri Lanka to develop mobile phone apps that doctors can consult. We've developed handbooks for cause of death certification with a bit more detail, and we've developed online and offline tools to guide the evaluation of how much knowledge, that retention of knowledge for cause of death certification, how effective has it been. Well, the Sri Lankan experts have worked very, very closely with us to jointly develop these tools that I've just mentioned. So the incredible input that we've had from our Sri Lankan experts on developing these tools, these guidelines, these offline assessment methods for evaluating the success of cause of death certification have been primarily driven by experts at Sri Lanka. We've brought our own team together to work with them. Collaboration has been fantastic so far. Sri Lanka now has the tools to dramatically improve cause of death certification in hospitals. We're working from a pilot test in 5 hospitals. We've now scaled that up with Dr. Samatonga's and her colleagues' assistance to 25 hospitals. We're trying to change the culture in those hospitals with Dr. Samatonga so that they fully understand their responsibilities in correctly certifying causes of death and why that matters. So we will continue working with Sri Lanka, the Ministry of Health, right through to the end of this phase of the Bloomberg Data for Health initiative. We will continue to provide the technical support as needed to our Sri Lankan colleagues for training doctors in these hospitals, these 25 hospitals, in correct certification, for training master trainers. We've trained 125 with our Sri Lankan colleagues. We need to do more. We need to saturate this philosophy and this technical expertise in the Sri Lankan hospitals so that the quality of the data that the government of Sri Lanka has for policy and planning is vastly improved. Well, if we've still got time, and this is already a big task for all of us, but we're very committed at the University of Melbourne to providing that technical support and supporting the government of Sri Lanka. If we do have time, I really would like to offer a course that we've developed at the University of Melbourne called Anaconda, which is the analysis of national causes of death for action. And it's important for Sri Lanka because it will show just where the problems are in terms of data quality. What are the typical errors that doctors are making? What is the level of completeness of their registration systems? How accurately are they recording age and sex? All of these really important indicators of data quality that we need to focus on. Anaconda will be able to show experts in Sri Lanka how to identify these problems, and then it's up to the government, of course, to act on them, which we sincerely hope they will.